Hello, my name is Rosalind Willis. I'm an Associate Professor in Gerontology at the University of Southampton. I'm here to talk to you today about some research that my colleagues and me carried out, and it was funded by the National Institute for Health Research, the School for Social Care Research. So the project is about satisfaction with social care services and how this relates to ethnicity. The project aim was to compare the reasons for high or low satisfaction with social care among people from South Asian and white British backgrounds. This research was important for many reasons, including the fact that the ageing population means that the number of people who need help with everyday activities like bathing and dressing is increasing, and also the fact that the minority ethnic population in Britain is ageing such that the population aged 65 and over is now much more ethnically diverse than it has ever been. And social care services need to ensure that their services are provided appropriately for every member of the community. It's commonly thought that people from minority ethnic groups do not use social care services, but actually rates of service use have been increasing over the last few decades. Although use of social services has been increasing, this does not mean that experience with social services is the same. And in fact, national surveys show that people from minority ethnic groups are actually less satisfied with social care compared with the white population. But we did not know the reasons why, and we carried out our study in order to understand that more. We used a qualitative approach in our study. We carried out individual interviews with 121 people, and they included service users, family carers, and social care practitioners. The service users and carers were either from South Asian or white British backgrounds, and the service practitioners were from a range of ethnic backgrounds, which is reflecting of the social care workforce. Of our 82 service users and carers, only 11 of them chose a negative satisfaction rating. This included 6 South Asian and 5 white British people. So there was no ethnic group difference in overall satisfaction found in our results. However, there were differences in individual experiences. Although the majority gave a positive satisfaction rating, very few participants were happy with every aspect of their experience with social care services, and many justified their positive satisfaction rating by leaving out the negative experiences. For example, saying they were happy despite the long wait involved. We found similarities between the white British and the South Asian participants, and we also found differences. So among the similarities were that participants from both South Asian and white British backgrounds talked about how much they valued care staff who had a genuinely caring attitude. That's something they look for when deciding if they're happy with the service and is a mark of a good service. In terms of differences, language was an extremely important topic for the South Asian participants, as you might imagine. Several of the people we interviewed could not speak English or had only a limited level of English, and this led to a practical difficulty not only in using services on a day-to-day basis, but also learning about services in the first place. This impacts on people's understanding of how the social care system works. Language matching of care staff to clients was seen as the ideal solution, but ethnic matching was not considered important by our participants. Most of the South Asian participants found that the way to meet these needs was to use culturally specific services. However, the number of these services was being reduced because of social care cuts. In our analysis, we explored the ways that participants' expectations influence the rest of their narrative, and this resulted in an overarching theme that we called understanding of the social care system. Participants could be distinguished from one another by whether or not they had a good understanding of how social care systems were organised, structured and funded. Participants with a good understanding tended to discuss the more structural and organisational aspects of the system. They were able to lay blame for their problems on the system rather than on individual care staff. In contrast, participants who did not understand the social care system were frustrated because they could not identify the reasons for the problems that they had. They did not know why day centres had been closed or why they were not entitled to more hours of domiciliary care than they were receiving. Both white British and South Asian participants were represented among both those who had a good understanding of the social care system and among those with a poor understanding. However, there were more white British than South Asian among those with a good understanding of the social care system, and more South Asian than white British among those with a poor understanding. The key difference is not to do with ethnicity. Instead, it's to do with the fact that the white British participants were more likely to have had opportunities to build up experiences with the social care system, through helping to arrange care for their own parents, for example. When it came time to arrange for their own care, they could already draw on these experiences. The South Asian participants who had migrated in the last few decades, many without their own parents, had not had similar opportunities to build up these experiences. So the difference is life course experience and not ethnicity. We also interviewed 39 social care practitioners, which included people who work for local authority adult social services, private personal care companies, subcontracted from the local authority, and the voluntary sector. Within the practitioners' discussions of their job roles, the importance of enhancing independence, choice, and control was emphasised. The practitioners' work was shaped by an ideology whereby clients are enabled to become as independent as possible with the help of the services, and this is achieved through a process of negotiation between the staff and the client. Clearly, the negotiation process requires good communication. Language is fundamental to that communication, and many practitioners discuss the difficulties they faced when they did not speak the same language as their clients. Some practitioners said language barriers made their work impossible, because they wield language as a tool to achieve their professional goals. In some cases, the language barriers are partially overcome through the use of interpreters, but this was not always sufficient to enable the practitioner to work to their full skill level. Many participants felt that it was inappropriate to ask questions about a client's culture or their religion. Some practitioners believed it would be insensitive or offensive to ask such questions and that it would be perceived as prying. However, they also realised that not asking the right questions, especially at the assessment stage, would result in somebody's needs not being fully met. Many practitioners were not able to resolve this dilemma. Some felt paralysed with uncertainty about how best to proceed, and other participants were able to ask questions about differences and they did not see this as a problem, and these practitioners were much more confident and can be described as culturally competent. So we have some recommendations from our project. So despite few service users or family carers being entirely happy or entirely unhappy with social care services, there was a bias in our study towards positive satisfaction ratings. This implies that user satisfaction surveys need to be supplemented with more opportunity for users to convey their whole experience. There is a need to improve communication at every stage of the social care process, so people's expectations are realistic. This needs to be done from every stage, from outreach, assessment, through to follow-up calls and having a consistent key worker. These issues of familiarity are particularly problematic for the South Asian group in our study, who had additional barriers to this knowledge, including migrating relatively recently, language barriers, and a lack of awareness about what social services can do. And finally, social care practitioners should not be afraid to ask questions of their clients' needs when faced with cultural or linguistic differences. This is the essence of person-centred care. To find out more about our project, please email me. It's r.m.willis@soton.ac.uk. Thank you.